Hey everybody, I'm Dr. Joe from Chiro Health Spa. If you've had headaches, we're going to give you a little overview about all the different things that we can do in the office for headaches. Now, there's lots of different kinds of headaches. There are tension headaches, there are migraine headaches, there are cluster headaches. The ones that we focus on mostly are called cervicogenic headaches, where they're actually headaches that are coming from your neck. Well, how could a headache be coming from your neck? Let me give you an idea. First thing that we're going to do in the office is do a full assessment to get an idea of where you have been. We want to see your history. Have you been in a car accident? Have you had sports injuries? Did you fall off a couch when you were a kid? All these different things that can add up to showing us now exactly where you are, where you've been can really give us a lot of clues there. Now, the next thing that we're going to do is an exam. So we're going to go through a whole bunch of different things like range of motion. We're going to go through muscle strength. We're going to look at your reflexes. And then we're going to get an idea of between all of those things, are you considered a chiropractic patient? And if that's the case, and we find that this is a chiropractic problem, that's when we start taking action. Now, the first thing that we're going to do is take x-rays. And the x-rays are very important for a couple of reasons. Number one, we're going to look at your structure, but number two, we're going to give us some clues as to how and why you might have these headaches. So let's take a look at x-rays real quick. What you're looking at here is a person's jaw right there. You're looking at the back of the skull. There's two major lines here. You can see there's a green line and a red line. The green line is where a normal person's curvature should be with their neck, and the red line is this person's his neck, okay? And as you can see, there's a big difference between where he's supposed to be and where he actually is. Same thing when I'm looking over here. This is the left side, this is the right side. I'm actually looking at his back, and what do we see? The green line is the normal, the red line is him, and we can see that his posture is not where it's supposed to be. Now, that's one of the things that we're going to look at for you is when we're dealing with headaches, this is one of the biggest clues, because if that neck posture is not good, it can certainly cause a lot of tension that's going to go up into the head, into the eyes. Some people get the chronic headaches that are going over the eyes. These are all things that this is a major clue over. So when we look at that and we put everything together, the next step is to start working on adjustments. Now, chiropractic adjustments, if you've had them in the past, you can get an idea of what they've done, which is probably they put you on your stomach, they would push down, they would roll you on your side. Where our adjustments are a lot different is for one major thing, and that's because of the fact that we are focused on taking a posture that automatically wants to drop forward and teach it how to come backward, all right? What we see primarily with people with headaches is that their head doesn't sit over their shoulders, just like on the x-rays I just showed you. So if the head is going forward, we need to be able to teach that posture to come back this way. So we actually do a lot of our adjustments standing up, believe it or not. The way that we do it is you're right here, and I'm gonna come up and I'm gonna push this way, which is ultimately going to give you more strength so that everything will sit. Your shoulders will sit better over your hips, your ears will sit better over your shoulders. And the idea of adjustment is really to get the bones moving, but get them to a point where your whole structure is stronger, not only for the short term, but for the long term. Now, we use the adjustments as one part of it, but we also know, listen, we have to get rid of the headaches, which generally involve neck tightness as well. So one of the things that we're going to look at is when we're doing our exam, we're going to feel through here and say, listen, if you have a lot of neck tension, is there something that we can do to help you relieve that? Well, in fact, there is. And one of the things that we use is something called electrical muscle stimulation. Now, what we're going to do with electrical muscle stimulation, you may have heard of this. It's something, a lot of people refer to it as STIM. If you've been to other chiropractors or physical therapists, they use this to literally just help relax the muscles, make them tired so that they're not in that such tense feeling. So we actually use these two little pads. We're going to put them right up, let's say, on the top of your shoulders, and allow those muscles to just calm down. Most people just say this feels like a nice little massage. It's very easy to just sit there and let this guy work and do a lot of real just relaxation while you're there, okay? Now, if we have some other things that are going on with the headaches that might involve inflammatory stuff, inflammation up in the neck or the shoulders, one of the things that we're gonna do is use something called cold laser therapy. Now, cold laser, the main job of cold laser, it actually is a laser, all right? It's not like a Star Wars laser, but what it is very simple. We're gonna rub this onto any areas that are inflamed. Now, in a case like with headaches, sometimes there's more inflammation like underneath the base of the skull, and this is very good for helping that to relax. So we're gonna use these things to help you get out of pain. One of the other things we're gonna use, and especially if you've had headaches that are coming from a herniated disc, for example, and a lot of people will get those, is you probably have felt, man, if somebody would just take my head and lift it straight off my shoulders, this headache would go away and I'd feel a lot better. Well, that's where we have something called spinal decompression. And we're going to use it for the neck. So in this case, what all you do is lay here and allow this machine to just literally open and close the neck and the joints of the neck. What it's going to do is create space. It's going to allow those sensitive nerves to have some breathing room. And a lot of people, as I mentioned, if you've had a headache from a herniated disc, this is one of our weapons of choice, as I like to call it, because what this is going to do is just take that pressure directly off of the nerve, because we're actually going to get some space in there. And it's very simple. Like I said, you just lay there and allow the machine to work. How does it feel?
It feels so great.
There you go. So there's the proof right there. Now, the next thing though is that let's say we work on the headaches and we get you starting to feel better and start you getting out of pain. The next thing though is that I can't leave your posture in a bad structure. So I want to be able to get you stronger into a good structure. So how are we going to do that? Well, the first thing is we're going to teach you some exercises that are very specific for your posture, okay? So in this case, like the person I showed you before, we might actually do something to strengthen the back of the neck so the head can start coming backwards. So we might do an exercise such as this, where we'll start pulling the head back and teaching your body to get these guys to strengthen so that your head doesn't want to continue to fall, okay? Now, again, like I said, everybody's posture is a little bit different. So we have to look at your x-rays and your history and your consultation to determine exactly what exercises you need. Nobody gets the same stuff in this office because everybody's posture is different. So that's very important. So we want to make sure that we give you the exact exercises that you need. And you'll be doing some of those in the office. We also have a home plan that you'll be doing in conjunction with the things that we do. Now, the other thing too is that when you look at people with headaches, as we said, forward head posture from computers or phones or tablets or all the different things that we do in a day can actually create a lot of neck tension that will create headaches. Well, there's two things that we're looking for on the x-ray besides the general structure. The first one is, what does that curve look like? Like I said, I hope it looks like this. Some people have a very straight curve. Some people actually have a reversal of that curve. We're going to look at your x-ray and find out exactly what that's doing. Now, if you have no curve, like a straight line, this might be some of the things that we do. This is a form of traction that what we'll do is we'll actually have a weight here that will pull up. You'll be sitting right here facing this way, and it'll pull up, and we'll have another weight over here. And all that's going to do is gently kind of teach that spine to go from a straight line to a curved line. And that really helps the body to function better, because at that point, the head and the neck are in a better position, and then that's how you start getting those headaches solved for a long period of time. Now, if your posture is more along the lines of a forward neck or a forward head posture, like a lot of people have, like I said, this might be one of the tools that we use. Now, this guy will be to teach your body to go into this posture. Now, it's not as easy as just sitting here and laying like this, because we'll use head straps and we'll use weights and we'll teach it to really get back, because we have to teach your body the exact opposite of what it's doing on an everyday basis, which is most likely going forward or going down. Well, this might be one of the tools. That's where some of these other tables come in, is that everything is geared toward changing your posture for the better, all right? You may have seen a lot of things in this video that you've never seen either from a chiropractic office or a physical therapy office, and that's by design, because our focus is changing and correcting posture. And the more that we can do along those lines for you now is the more that it's going to save you in the long run and help you for the long term. All right. I hope this video helps you as far as what we can do for your headaches. Please feel free to contact us and give us an idea of what's been going on with you, and we'll do everything we can to help. If you know anybody with headaches, please share this video. This is a really good overview of all the different things that we can do, and we just want to help everybody that we can right now so that you guys can live the best life that you possibly can. All right. Look forward to seeing you in the next video. Take care.